Welcome to Prescribing Hope, Azithromycin Unmasked, where we crack open the stories behind the medicine that defined the COVID 19 fight. I'm Rittika, your host, and today we are spinning a tale of unsung heroes, pharmacists who worked behind the scenes to keep azithromycin safe during the pandemic. Our guest is Saakshi with a knack for decoding the chaos of crisis medicine. Saakshi, ready to spill the secrets of this pharmaceutical heist?
Absolutely, Ritika. Let's pull back the curtain on the pharmacists who were the real MVPs.
Let's set the scene. It's 2020, COVID's got the world in a chokehold, and azithromycin is being prescribed left and right. So, what unique challenges did pharmacists face in managing azithromycin's safety during COVID 19 frenzy?
Pharmacists were like air traffic controllers in a storm. Azithromycin's sudden spike in use, often off label for COVID 19, created a perfect storm of challenges. First, they had to screen for drug interactions at lightning speed. Azithromycin can prolong the QT interval, raising the risk of dangerous heart rhythms, especially when paired with drugs like hydroxychloroquine or antifungals, which were common in COVID 19 protocols. Pharmacists were cross referencing patient charts against databases to catch these risks, often with incomplete information during telehealth surges. Second, they faced supply chain chaos. Azithromycin stocks dwindled as demand skyrocketed, forcing them to prioritize patients and verify prescriptions to prevent hoarding. Third, patient education was a hurdle. Many patients did not know azithromycin was an antibiotic, not an antiviral, leading to misuse or unrealistic expectations. Pharmacists had to counsel on side effects like diarrhea or nausea, which affected 10 to 15% of users while ensuring adherence to short 5-day regimen.
That's intense. Picture pharmacists as detectives in a high stakes mystery, racing against time to spot dangerous drug combos, guarding the azithromycin vault from shortages, and clue patient is on what this drug can and can't do. So, how did pharmacists handle the pressure of incomplete patient data and especially with telehealth booming during that time?
It was like solving a puzzle with missing pieces. Telehealth meant pharmacists often got bare bones info, no recent EKGs or full medication lists. They leaned hard on electronic health records when available, but many used triage style questioning during phone or virtual consults. They would ask patients directly about heart conditions, other meds, or recent symptoms to flag risks like QT prolongation. Some pharmacies also adopted rapid response protocols, like calling prescribers to clarify orders or recommending EKGs checks for high risk patients before dispensing. It was resource intensive but critical to avoid harm.
Talk about quick thinking. So the next question is, how did pharmacists balance azithromycin's risk like heart issues with the urgent need to dispense it during the pandemic?
Pharmacists were like tightrope walkers, balancing speed with safety. They used a layered approach. First, they prioritized risk screening. For every azithromycin prescription, they would check for QT prolonging drugs using tools like Lexicon or UpToDate, flagging combos with say amiodarone with amiodarone or certain antidepressants. In hospitals, they collaborated with doctors to monitor EKGs in real time, especially for ICU patients where arrhythmia risk hit 1 to 2% in 2020-2021 data. Second, they optimized dosing, sticking to the standard 500 mg loading dose, then 250 mg daily for 4 days for most, but adjusting for patients with kidney or liver issues to prevent toxicity. Third, they pushed patient counseling even in chaos. They would explain, take this with food to ease stomach upset, or call us if you feel heart palpitations. This was tougher in outpatient settings, which, where time was short, but many used handouts or quick video guides to bridge the gap.
So, pharmacists were the master chefs, carefully mixing ingredients to avoid a bad reaction, tweaking the recipe for each patient, and serving up advice to keep things safe. Were there any standout tools or innovations pharmacists leaned on to pull this off?
Oh, yes, many turned to tech like never before. Drug interaction software became their sidekick. Think apps that ping alerts for risky combos in seconds. Some pharmacies integrated decision support tools into their systems, auto-flagging prescriptions for review if a patient was on multiple high-risk meds. In community settings, pharmacists created cheat sheets for common COVID-19 regimen, summarizing azithromycin's risk and monitoring needs. Telepharmacy platforms also exploded, letting pharmacists counsel remotely while cross-checking prescriptions. These tools were a total game changers, cutting through chaos like a hot knife through butter.
Love that. Tech as a trusty sidekick. So, what's lasting impact did pharmacists work with azithromycin during COVID-19 have on pharmacy practice for future crises?
Pharmacists' role in the COVID-19 saga rewrote the playbook. First, they proved their value as gatekeepers. Their work catching drug interactions and educating patients led to policy shifts, like expanding pharmacists' authority to adjust doses or flag risk without prescriber approval in some regions. Second, they drove tech adoption. Real-time drug interaction alerts and telepharmacy are now standard in many practices, informed by 2020's lesson. Third, they spotlighted stewardship. Pharmacists' effort to curb azithromycin overuse helped keep resistance rates stable per global surveillance data, hence setting a model for antibiotic management in crisis. Finally, their advocacy for patient education led to better tools like multilingual handouts and apps that make complex into accessible. These changes are now baked into training programs, ensuring pharmacists are ready for the next big challenge.
That's epic. Pharmacists went from behind the counter heroes to rewriting the rulebook like masterminds pulling off a heist that saves lives. Are there specific training programs or policies now in place to carry these lessons forward?
Definitely. Pharmacy schools have added crisis management modules, teaching students to use decision support tools and handle high pressure scenarios like COVID-19. Organizations like the American Pharmacist Association rolled out guidelines for telepharmacy and stewardship, standardizing practices globally. Some countries even passed laws giving pharmacists more autonomy to manage meds like azithromycin during emergencies. It's a legacy of empowerment, ensuring pharmacists aren't just dispensing, but shaping the outcomes.
What a legacy. Sakshi, thank you for shining a light on these unsung heroes. Listeners, pharmacists didn't just fill prescriptions, they were detectives, tightrope walkers, and innovators keeping azithromycin safe in the COVID chaos.